It's worth noting that far too much keyhole surgery is done and has been done. I think it's improving, but the insurance companies have worked out that excessive use of surgery is fairly widespread. And for example, the most common problem is somebody with a degenerate tear of their meniscus, usually the medial meniscus. That's a normal part of aging. And those people do not need an operation in the vast majority. I've got one of those tears. It was sore for a couple of months and it's got completely better. And the usual scenario is someone my age, I'm 58, decides they're going to die, so they start running, having not run for 20 years, and they overload their knee and they get a sore kneecap. If they're well off, they're insured, they get an MRI scan, and it will show a meniscus tear. They're very, very common. And then if you meet somebody who is either foolish or perhaps unscrupulous, they will offer you surgery. What you need is a strength and conditioning program with a good physiotherapist. So that's one example of where surgery is rarely needed. There are some more controversial areas. Not everybody who has an ACL rupture would need surgery. But what I would summarize is that most young active people, and I think that young can be stretched a bit, will benefit from a good operation. Now, I choose my words very carefully because the worst thing is a bad operation. And so you need to choose your surgeon very well if you can have an operation. But if you're active, if you want to play sport, if you want to do activity that involves change of direction, that may even be dancing, and certainly if you want to ski, then most people benefit from the operation. There are some things, of course, that always need surgery. For example, if there's a big meniscus tear that displaces into the joint and jams it and you can't get straight, then that will need surgery within a matter of a few days, either to repair the meniscus or remove it, depending on the state of it and which meniscus it is. If it's lateral, I would always do my absolute best to save it because the consequences of losing it are so great. With some soft tissue injuries, you do need to get on with surgery. And with the COVID experience, when quite rightly elective planned surgery was very restricted, we have seen unfortunately consequences of that. For example, patients with a locked knee, for example, with a meniscus that displaced and jamming the joint, patient couldn't get the knee out straight. If that's left too long, they may never get their knee straight and then require surgery to correct that. And that, around the country, there have been cases of that, sadly. You can understand the circumstances. There are other cases where it's less urgent, but for example, with anterior cruciate ligament surgery, the success of an operation long term can be determined partly by the time between injury and surgery. And there's increasing evidence that if an ACL is left for a year or more, and to some reports even 6 months or more, that the long-term results are inferior. On the contrary, there are some situations where having surgery too early is bad. And this is really important for skiers to know because there are resorts in the Alps that will encourage patients to have surgery immediately within a day or so of injury. And very rarely is that necessary. And it often leads to problems. And in fact, if somebody has an injury and the knee is very inflamed and stiff, if they then have a second injury, and surgery is a controlled injury, it can make all of that worse. And we do see patients being flown back from the Alps following what I would say is excessively early surgery with significant complications of stiffness that can be permanent.